Hi, I'm Dr. David Barnett, and I'm a neurosurgeon in Dallas, Texas, with over 30 years of experience treating patients with spinal disorders. Today, I want to talk to you about lumbar disc herniations. Let's start with a little anatomy. The discs are the pads or the cushions that separate the bones we call vertebrae in the spinal column. A disc herniation occurs when there's a tear or an opening in the outside of the disc called the annulus, allowing some of the inside of the disc to herniate or protrude into the channel where the nerves travel. Frequent symptoms if this occurs are pain in the lower back or paraspinal region. If the nerve is compressed or pinched, patients often experience pain in their buttock region, radiating down into the leg in the distribution of where that nerve travels. Sometimes, especially with larger disc herniations, patients can experience varying degrees of nerve symptoms, neurologic symptoms such as numbness, weakness, or even tingling. Frequently, when patients begin to have their symptoms, they will either seek help with their primary care physician or in severe cases with the emergency room. The primary care physician will oftentimes make an initial diagnosis and then refer that patient for an MRI scan to establish the diagnosis. Once the diagnosis is made, a treatment plan can be made. Now, usually we will start with conservative modalities. Most lumbar disc herniations will heal without the need for surgery. They are not a one-size-fits-all. Some disc herniations are small with only mild compression of the nerve roots, whereas some can be quite large with even severe symptoms and even neurologic deficits. But the initial treatment, conservative modalities, fall into three basic modalities. One are medicines to reduce inflammation or to calm the nerve down. The second and frequent option that we refer patients for is physical therapy. A good physical therapist can work with a patient on range of motion, decompression, electrical stimulation, and other modalities to help reduce the patient's symptoms. Finally, another option is pain management injections. Sometimes we'll make a referral to a specialist who can put medicines around the nerve to calm down the nerve irritation. If those modalities are not working, or if the patient has a severe neurologic deficit, then we will consider surgery. Now, it's imperative to the patient's long-term well-being and success that they choose a neurosurgeon who's had lots of experience, has good judgment, and excellent technical skills. This surgery can be performed through a minimally invasive microdiscectomy approach. Briefly, a small incision is made on the lower back area over where the disc herniation is located. The muscles are scooted to the side. This is done through a small incision, and an opening is made into the spinal column where then we can remove the fragment that's compressing the nerve root, and then we're done. Typically a 45-minute to an hour-long procedure. If the patient's well selected and they have a good surgeon, there should be a very high degree of success. If you've been told you need surgery and you live in the Dallas-Fort Worth area, we'd be happy to see you for a second opinion. Thank you for your time. This is Dr. David Barnett. Thank you.